Hey, Facebook family. Happy Thursday. Happy Thursday. It's Dr. Marcie, and I am so excited. I've been busted. I've been holding this in for a minute. I'm launching a new show called Thriving Thursdays. And if you just saw my brief Facebook Live post a minute ago, you heard that this is all about thriving. I did a lot of thinking over 2018 and just thinking about so many of us are existing, even if we're making a lot of money or we're married, we have kids, we have the pie in the sky. We find that we are just kind of rolling through life, right? And we're not really thriving. And so really moving past just living well, living good, trying to make the money, side hustle, get the man, have the kids, do all this, get the bigger house, really taking time to see what it takes to get us to thrive. Because when you enter into thriving, ooh, that's when the good part starts.
Like a level.
Morning, Valika. And so Thriving Thursdays is going to really be about bringing women on the show that can give all of us great information to help us thrive, right? And so just moving forward, that's our word for 2019. Thriving, 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 moving past just existing, just living, but how do we thrive? And so welcome, welcome, welcome to Thriving Thursdays with my first guest. I'm so excited here why I'm so excited to have Dr. Leslie Hodge on here because hey, Dr. Hodge is a pharmacist like me.
Nothing like it.
So I thought, what better way to kick this off than with a fellow pharmacist doing amazing things to help people thrive. So welcome, Leslie. Welcome.
Thank you. Thank you. Thank you. You're talking about you're busting. I've been busting too. I've been keeping a secret. I'm like, oh, I can't say anything just yet. So thank you. Excited. Excited.
Yes. So we're on here today. The topic is actually a pretty serious one. We're starting off really showing that, you know, just when you hear Leslie's background, you hear what she's doing in the world, you hear what value she's adding to people's lives, you're really going to be moved, and it's going to give you some really great information for you to take forward in your life, whether it's through Leslie or not. You'll really be able to move forward. So Leslie is the founder and operator of Scripts and Beyond LLC that's based in Indianapolis, Indiana. Yes. Dr. Hodge earned her PharmD from
Yes.
university, right?
Yes, Purdue. Go Boilermakers. The Harvard of the Midwest is what we refer to it as.
I didn't know that. I have another friend, daughter went to Purdue and she loves it, loves it, loves it.
Yes, absolutely.
I went to Howard University, get my
Nothing like Howard.
and so you've been
Vicer.
for 14 years.
Yes, 14 years. I still can't believe it. Even to say that, it's like, wow.
I know. I graduated in 2000.
It's like, man.
Yeah.
Man.
When I graduated, I'm like, wait a minute. I keep saying, like, you need to up that number because it's been,
Right.
it's been a minute. Hey, Ashley. Ashley is here. Hey, Ash. And so one of the things you've been doing really as serving as a community pharmacist, but also in your professional success, really being able to pour back in the community. And one of the things is really helping people to know, right, the must-dos when it comes to prescriptions.
Yes.
That's really what we're here to talk about, right? Some serious things that people need to consider about medications. The whole opioid epidemic, right, has been on for years right now, but is now in the forefront. But medication abuse has been something that has our communities have been dealing with for a very long time. So I applaud you for what you're doing, for what your company is doing to really help people to, again, know what they need to do when it comes to medication. And as a fellow pharmacist, it just warms my heart to know that, being part of the number one trusted profession in America.
Yes, number one.
Right thing here. So I
Yes.
So tell us about Scripts and Beyond.
Sure. Scripts and Beyond. I would say even in being a pharmacist, I kept seeing in the community setting. So we talk about practicing pharmacy in a hospital, or when people think of pharmacy, I love when I talk to students and I say, when you think of pharmacy, what comes to mind? They always say, oh, Walgreens. That's immediately what comes to mind, or CVS. So you think about the pharmacist in the white coat behind the counter, not, you see them, but you can't really get over that big old counter. And so doing that for, I think it was about 10 years, 11 years, I kept seeing the same thing. And that was people picking up prescriptions, but not able to tell you sometimes the name of it. They were just in, autopilot. My doctor told me to come to the pharmacy and get it, and I get it. Okay, well, what's the name of it? Or what are you taking it for? What are you hoping to accomplish by taking it? And they couldn't answer the questions. But when I would have that time to talk to them, they would say, oh man, I wish I could talk to you longer, or I wish I could sit down with you. So it was like an aha moment. And so in late part of 2015, I launched Scripts and Beyond. And the theme is a pharmacist focused on you, because so many times decisions are made for people and not with people. And so I really try to incorporate the lifestyle that the client has, the resources that the client has, and create a plan for them so that they can be successful. You want to feel successful. You want to be successful. You don't want to feel like you're someone's guinea pig and there's no hope. So I like to say I put hope back into the situation, hope back into the health, I guess, just attitude, and just really the focus back on putting them at the center and making them feel like they are part of the solution. Because we can go to the doctor every day, but if we don't do our part, what's the point? What is the point? Wasting money and time. So yeah, that's where it started.
I love it. I love that you had the wherewithal to still be able to connect with the customer, with the patient, even across the counter, right?
Absolutely.
And what makes a good pharmacist is being able to lift your head, no matter where you are, being able to look up from the counter and see that person that's across from you, and see, number one, where there is a disconnect. And that's very true. It's like, so many people are coming to the pharmacy, especially in the community setting. How many, it's all, sometimes it's about volume, and you're just you can get so focused on reaching that number that you don't have a chance to connect. And so I applaud you for seeing that, these patients were in need.
Absolutely. Thank you. And I love how you said lifting your head, because that's what it's about. We talk about our profession and being the number one, respected and, accessible. That's the key. Pharmacists are accessible. And so when people really begin to utilize us, I feel like there's no limit. There's no limit. There is, again, that hope we put back into their health care situation. Like, you can do this. You don't have to be on this medication for the rest of your life. You don't have to deal with these side effects for the rest of your life. We can really help bridge that gap. And so that I love when you said that. Just lift your head and just begin to make that connection. Sometimes that's all people need, is to know that they are seen and heard and focused on. And then the rest is history. What'd you say?
Yeah, we all want that. We all want to be seen.
Yeah, absolutely.
And sometimes, especially in certain communities, they're not, it's just like, okay, your insurance didn't go through, and you to be able to step back and see that person. And I really applaud you.
Thank you.
Another thing is that is great that you can teach us. And I love your quote from Luke 12, chapter 12, verse 48. To whom much is given, much is required. Yes.
Yes, ma'am.
In knowing you, I know that you really live that. I know that. And in your work and in what you're doing in the community, and what Scripts and Beyond is doing, it really shows that. And so you have 3 things that you really want us to take away from this. 3 things: empowering yourself to, do better, to know that, you should be able to talk to your pharmacist. You should be able to talk to any healthcare professional in a white coat, right? So these can translate to your dentist. It can translate to your doctor. It can translate to a DO, MD, PharmD, whatever D you have. You should be able to have that conversation, right?
Absolutely.
And so one of the things is to ask questions.
Yes, ask those questions. I think too, Dr. Marcy, is knowing that you can, right? So it's the empowerment. It's okay to say you don't know. It's okay to say, can you please let me know why I'm taking this? What is the reason I'm taking that? That kind of goes into that whole advocacy, the word that we're starting to hear so much. You have a right to know. You have a right to ask the question. You have a right to receive the answer, right? That is applicable to you, not this just generic response. You have a right. And so empowering people and knowing and letting them know, hey, ask the question, know what you're taking, know what to expect when you take your medication, know how to store your medication. It's so many things that we think as pharmacists are, almost, well, you should know that, or you would think someone would want to know that, but a lot of people are afraid to ask. And a lot of people are rushing, right? So you're at the pharmacy, you're like, I need to get home. I'll think about that later. And then later comes and you suffer in silence. And there's no need to do that. It's no need to do that. We are accessible, like you said, the white coats, anything, MDDO, ask those questions, get the answers that you need.
Yeah. So what are some of the questions, you went over a few of them, but what are some of the core questions that we should kind of have in our pocket to ask in the doctor's office? Just and it could be small questions because you maybe have baby steps because you do have that apprehension with, I think sometimes we feel like we're challenging them. Like we don't want to challenge our doctor. They have our care. We don't want to, like, it's like being mean to the waiter.
Right.
Oh, no. Right. So how do we push past that apprehension we have or that barrier? What are some of the things we can do to actually turn it into a conversation and not feel like it's a confrontation?
Absolutely. And I think the number one thing is remembering that you are the patient. Okay. You are the patient. You're the one being served. You're the one seeking this medical help and attention. Number one question, what is the name of the medication? I feel like that seems so simple, but you would be amazed at how many people are taking medications day in and day out. They cannot tell you the name of it. They can tell you what it looks like, the little yellow pill, the little white pill. And you know how many little yellow pills there are in this world? We will be looking for days trying to figure out if you don't know the name. Know the strength. Know, the milligrams of the medication you're taking. Know how you're supposed to take it. That sounds so simple, but I have people that ask me, my doctor told me to take this twice a day. So what does twice a day look like? Is that morning and night? Is that morning and afternoon? What does that look like? Ask that question. What am I going to expect? What side effects am I going to expect? I mentioned that earlier, but that's so key because a lot of times, and you know this, but a lot of times people experience side effects, but they're misinterpreted as other conditions. So now another medication is added on to their regimen. So if you know you're taking something and the doctor says, and you should say, hey, doc, thank you, you're treating your blood pressure. And the doctor says, you're going to take this once a day. Well, what should I expect? Well, if you become lightheaded, you may feel nauseated. Those are the things that going into, you can address them proactively versus feeling like it's not working. I got a headache, so it must not be working. Or I'm nauseous, I can't take it, it must not be working. No, that may be a side effect, but how do you manage that? And so those are some questions you would ask. And any doctor, any true, good-hearted, personable, keyword, personable healthcare provider is going to welcome those questions because they want you to be informed. Because that means that's less times you have to come see them, right? That's less times you have to call them. That's less times that you have to have other medications added. So it's a win-win. So don't feel intimidated. Don't feel like you can't ask because it really is beneficial to you and your relationship with your healthcare provider.
That was awesome. Those are great, right? We have so many comments that were popping up. We're talking because I think it's definitely resonating. First, let me say thank you, ladies, to everyone who shared this because as you guys hear, this is critical, right? This is information that we need. Again, in 2019, it's about thriving. And you have to have the information that you need so that you are armed and you are ready to go out and thrive, right? And so this is critical to ask. So I thank everyone who has shared this video so far. And welcome to, we have another pharmacist on the line, Dr. Raymond Farmer. Hey, Ray. Thank you for tuning in. And we had KJ asked a question. Now, she just left the pharmacy and she talked about how, just in taking her inhaler properly, the pharmacist was so nice. So that was awesome. We love to hear that. We love to hear that a pharmacist was taking the time to answer your questions and to just see you as a person, right? That's from another pharmacist. It warms our heart to know that you had that experience. And then Yolanda says that she wants to know what she's taking and why. Good job asking those questions. And then, just helping, especially anyone that may be elderly or who from the baby boomer generation or a great grandmother or grandmother's generation, where they're taught not to challenge, you just do it. How we can help them to kind of break down those barriers and that advocate for them is awesome. And Dr. Thies is here too. She is a psychologist as well, and she sees patients and she wants her clients to know the name. They know the name of the medications they're taking. Yeah,
absolutely. Can I just say one point to that about the knowing the names? It's so important to keep a list. And I know we're in this technology age where everything is in our phones, but keep a list of your current medications, because when you go to different doctors or maybe you're going to a specialist, that's one of the first things they ask when you're filling out the information sheet and the welcoming sheet or the welcoming packet. What other medications are you taking? Because then they can make sure that they're not giving you something that's going to interact with what you're already taking or cause any more harm than good, or also find out what you've already taken so they know not to repeat that. So it's to your benefit. Okay, that's a way of being your own self advocate, knowing your medication list, knowing what you've already taken, what's worked for you, what hasn't worked for you. And that's another question to ask too. What should I expect? How will I know this medication is working? That's so simple, but we sometimes don't even think to ask that. How will I know this medication is working? How will I know it's not working and I should actually call you or, make another appointment because something else is going on? That's a question to ask and be armed with that information.
You know what, in terms of lists, it's so beneficial because what if you're going to the dentist and they need to know getting some dental work done? Taking a medication that may be thinning your blood, and so you have an extraction or something, maybe it's not stopping, bleeding is not stopping, so those things, it's always good to keep the doctors in the loop with what's going on with, so they can make the best decisions for you as well. Always be honest about what you're taking.
Absolutely.
Yeah, so thank you. Taronda talked about, asking about the side effects is important. Things that you don't even think about. KJ also mentioned supplements. And I know in terms of her background with dealing with breast cancer, she could not take the supplements that for Edlin Essentials. And I always ask the question, because I'm like, for me, I took a Hippocratic oath. I'm always going to do no wrong. So
absolutely no harm. Yes.
Everyone.
Yes.
Right? Don't do any harm. So those, everything is not for everybody. You have to be able to have full disclosure and just say, you know what, this is not a good fit for you because of this. So always ask questions. If you have a precondition that may stop you from being able to take things or do things, always ask and have a conversation with your healthcare provider.
Always.
Information. This is
always be upfront and be honest. You're only doing yourself a disservice when you're not, and when you keep information to yourself. Be honest, be upfront. It's okay.
She's here. We have so many great women tuning in. I love it.
Awesome. Hi, ladies. And gentlemen. I know you said some men are on too. Awesome.
I didn't hear you.
I said, hi, ladies, and hi, gentlemen. I know you said some gentlemen were on too. So I was just saying hello to everyone.
We do. Okay, so point 2. So we have the first point was ask questions, right? Ask questions. We're armed with some great but simplistic questions, right? Just be able to ask these questions to get the information, make a list so that you are informed, so that you can take these lists to other doctors so they know that what you're taking. The other thing is advocacy. And I think this is all, advocacy is all kind of looped into these points, but the second is advocacy.
Say the last part. I'm so sorry. It went out.
Advocacy, patient advocacy, being a
yes, looking out for yourself.
Did you go out?
I think it's freezing. I heard you say advocacy.
I did.
Okay. It's so important. I'm sorry, the screen froze a little bit, but it's so important. You are your number one advocate, and if you're not your advocate, you're the advocate for someone else. You're talking about what's in the best interest of you or your loved one or that person that you are the advocate for. And that includes asking the questions. We keep going back to that, but it's so key because when we ask questions, that's when we're able to gather information. And when we're able to gather information, that's when we're able to make informed decisions. And when we make informed decisions, that's when we can begin to experience those outcomes that are desirable. Not just what the doctor wants, but what you want as the patient or as your loved one. Sometimes your goals may not be the same as your doctor's goals. You talk about something so simple as maybe someone is diagnosed with diabetes, right? And so the doctor's goal may be, I just want your morning blood sugar to fall between 70 and 110. But your goal may be, I want to lose weight. I want to not have to go to the restroom so frequently. I want to be able to, I'm thinking of some of those common characteristics that people live with and try to deal with and try to manage without getting medication or getting medical attention. And so when they do that, their goals will be totally different from the doctor. The doctor may be looking at it from a numerical standpoint, may be looking at it from what's recommended by, the American Diabetes Association. But as you, the patient, what are your goals? What do you want to see as a result of seeking medical attention? And so being your own advocate in that aspect, if something is not working, speak up about it. If you are taking a medication and now you are sleeping all day, I have patients, they say, I can't take that. I get to work and I'm asleep, or, I can't even get up for work. Be your own advocate. Speak up. Talk to your doctor. What other options are there? What else can I take? What else can I do? That's being an advocate for yourself. Or again, for your loved one. Maybe you notice changes in your loved one's mental state or their behavior or how they're acting, and you're noticing maybe they're sleeping longer or they're not sleeping at all. Speak up. 9 times out of 10, most appointments with physicians or nurse practitioners are so widespread, 3 months here, I'll see you back in 6 months. So you have someone dealing with the condition or a certain experience for 6 months. 6 months only because they don't have another appointment for another 6 months. No, be your own advocate. Make that phone call. Let them know what's going on. It may not require another visit into the doctor's office, but that communication is open. That communication, that dialogue is taking place. And you're telling them, this is not working for me. This is not working for her. This is not working for him. And I'm telling you, and it goes back to the white coat. True healthcare professionals don't mind being asked. True healthcare professionals invite you speaking up in a timely manner, not a year later, not 6 months later, but in a timely manner about what's going on. And they will help you navigate through that process so that way you can experience the desirable effects of whether it's the medication or get the outcome that you're looking for.
I love it. So let me tell you what, that was such great information. Hey, Roz, amazing. And what really resonated with me was have your own goals.
Yes.
have your own goals of what you want for the condition you have and from the with the medication, right? So when
Absolutely.
you visit, what goals do you have? Most times we go to the doctor, we're waiting for the doctor to tell us what
Yeah.
to do. But being an advocate means understanding what's happening with you and having goals, your own
Right.
goals to either how long do I want to deal with this condition? What is my, what are my goals that I'm going to push through? How long do I want to be on this medication? How
Hmm.
often do I want to see you? What am I going to do? And like how many other practitioners do I need to pull in? Do I need a nutritionist? Do I need a health coach? Do I need,
Absolutely.
what are some of the things that I need to meet this goal? I love that. That
And
immediately.
that even goes back to medication too. I'm sorry. Can you hear me, Dr. Marcy?
Hear you.
Oh, I'm sorry. Okay. I thought you stopped speaking. I'm sorry if I overspoke you. I was just going to say, going back to goals, and of course I'm coming from the medication standpoint. A goal for someone may be simple as if they are taking a medication 3 times a day, maybe they're improving to the point where they only have to take it twice a day. And then they're improving to the point where they move to once a day. Those are goals too, especially when you get to some of these more complex conditions where people are having to inject themselves frequently, having to test frequently, things like that. What those are goals too, and those sometimes are overlooked and not seen as part of the whole journey, the whole healthcare journey, but it really is. It really is, and that contributes to, again, depositing that hope into the patient and those that are, their support system and around them.
Yes, Dr. Hodge, I mean, seriously, this information is just amazing. If you guys or whoever's still on the call, if you guys, even if you listen on a replay, it just put in a heart or something to let us know that you are loving this information. I'm a pharmacist, and I'm telling you, I'm loving this. Even as a patient, or just thinking about so many people that are going to benefit from this information, whether it's themselves or a loved one, a
Mhm.
spouse, a parent. Just being able to, these tips are so applicable and so necessary for us right now. So thank you, thank you. And so KJ did a great job. We'll check in. Hey, Roz, she's mentioned attainable goals. Ladanya, she wants to know, should she be careful of experimental drugs, and are they usually useful?
That's a great question. So, of course, it depends on the patient. And I think that's something that is so important to say before I even answer that question in its entirety. There is no one size fits all in healthcare. Okay, we there are recommendations. Yes, there are things that typically work or have been found to work, but there is no one size fits all. And so you may have patients who very well may not find those favorable results from what is considered first line treatment or first line therapy or traditional methods of treatment, and they may benefit from experimental, but the response is still the same. Ask the questions. Make sure you understand what to expect. We know all medications have some type of side effect. Are you willing to deal with that side effect? Those would be questions to ask, because sometimes, and we hear it on the commercials all the time, sometimes the side effects are worse than the condition that you're trying to treat. And so you're wondering, maybe I could just maybe deal with this or manage this versus experiencing some of the side effects that come about. And so that would be my response. If you are interested in that, make sure you are making a well informed. It's okay to have a second opinion. It's okay to have and invite other healthcare professionals in on the conversation. Okay. And you mentioned earlier, you go to the doctor. It's okay to have a pharmacist in on the conversation. It's okay to bring in a dietitian. That's that collaborative care. And, we use that term in our field, and that may not be a term that, a layman's term, but collaborative care. We're in this together. We're in this together for the patient. And so if the patient is being faced with to make that decision, I feel like the more wisdom and education about the subject involved, the better the outcome. So not sticking to just maybe one source, but have a, with second opinion. It's okay. I know some people shy away from second opinion, but it's okay because it's nothing like having another set of eyes on a condition, especially when you're dealing with your health. It's okay. It is okay. And then you have to consider both, okay, or all three, but it's okay to have that input.
We
And I
shop,
would encourage that.
we shop around for cars. You can shop
We shop,
around.
yes. We get second opinions on everything else, but until it's our health, then we tend to shy away from that.
Yeah,
We tend to shy away. Agreed.
that's right.
Agreed.
Um, KJ said, hot flashes are an evil side effect. That's all she wants to say. That's it.
That's it.
Thank you, KJ, for listing, with the points that we've made so far. Thank you so much for that. She listed ask questions to remain informed about your condition, keep a list of your medications and dosages in your phone, be your own advocate, understand your condition, and what are your treatment needs and goals. Good job. Thank you for that. Yes. So our final point that we have really talking about the importance of the lifestyle changes.
Yes.
Always it. And one of the things I talked about last night on Wellness Wednesdays, I'm talking about nutrients, right? You need 3 things. We call it the trifecta, right? You need nutrients, fitness, and supplements to have balance, strength, and longevity, right? So one of those things, you can't just have nutrition without fitness, right? And
right.
Not really going to give you everything. You should try to have some type of supplement to make sure you're getting all your nutrients. Fitness, you can't outwork a bad diet, right?
Yes.
And supplements, you can't take a happy pill to make everything go away.
Exactly.
Work on a trilogy to make sure that you have, the balance, the strength, and the longevity. And it's the same thing with medication. You really, gotta make other changes in your life and just not think about just taking your medication and that's it.
Agreed. Agreed. I was gonna say that idea that just taking medication fixes and is the end all be all. Those days are over. we understand. I think we understand as a profession. We understand as a society. Balance is key, and so those lifestyle changes, those lifestyle modifications, again, they don't have to be so drastic. I think at one point, and I think even in pharmacy school, we would think that when you counsel patients, they have to do this. Oh, they've been diagnosed with this. They have high blood pressure. They have to stop all sodium. Okay, that's not realistic, right? Or if someone's diagnosed with diabetes, oh, no sugar. They can't have anything that, has refined sugar. Those days are over. Moderation is key. We know that. Education is key. And then consistency is key. I think that those would be those 3 things: the moderation, the education, and the consistency. Because when you keep doing something that's well informed and with good intention, you begin to see the benefits. And so even with taking medication, and that is one of the things that has just blossomed in our profession, is getting people to take their medications correctly, not just taking them, but taking them correctly, taking them as prescribed. So if it says twice a day, are you taking it twice a day at the same time each day, not just when you remember? Because then, your body's never, ever going to get into a state where it is consistent. So you have to make sure that consistency is the timing, consistency is the frequency, meaning, if it's twice a day, making sure it's twice a day. If it's 8 a.m., making sure it's 8 a.m. and 8 p.m., those types of things. But the lifestyle changes doesn't have to be a solo project. And that's one thing I stress with my clients. I encourage my clients, especially when I first meet them, bring your support system, whatever that looks like, right? Because sometimes we feel like, oh, I can do this on my own, excuse me. But it's nothing like having that support. So if it's the spouse, if it's the children, because when you don't feel like being consistent, they can give you that little tap on the shoulder, right? When you don't feel like making those modifications, they can be that tap on the shoulder for you. So it's okay to understand that it doesn't have to be drastic. but it has to be consistent. Okay. It has to be consistent.
I love it. And I was just about to ask somebody to just, list those points again. Moderation, education, and
And consistent.
that was it. It was like, to me, I was like, drop the mic.
Look, when I said it, I was like, okay, yeah, because that's what it comes down to. It really does. It comes down to that.
That was a word
Really
right there. I love it. I love it.
Excuse
So
me.
we say all this, and I know that Scripts and Beyond, right, is a medication and is a consulting company, right?
Right.
And so
Right.
tell us of these points and how your company helps so many people with so many of these challenges that we talked about, right? Tell us how your services can help us get over.
Yeah. So, going back to the pharmacist focused on you, that is the key, because when clients come to me, they're almost saying, help me. That's what they're saying, basically. Help me. I want to achieve those outcomes that my doctor, we talked about this earlier, that my doctor has set for me, but I have some goals for myself too. Help me. Help me understand what I'm taking. Help me understand what foods to avoid, what foods to include, because those are conversations that aren't always had when you're standing at the pharmacy window, or there's so much information now at our fingertips. It can be so overwhelming and you don't know what to trust and what to dismiss. And so I help really solidify what is factual versus myth for a lot of my patients. And my patients are mostly what we refer to as the complex regimen patients, 6 or more, 5 or more meds, and they are just trying to figure this thing out and have it incorporated into their life. So the focused on you point portion is, what's your lifestyle like? How can we create a plan so that you are successful, so you are consistent, so you are adherent? All those terms that we hear on, in the news and in the doctor's office. And then now, even from your insurance company, when you're signing up for prescription drug plans, they are asking, are you going to be adherent? We will reward you when you're adherent. That is the key, because they understand when you aren't consistent, that's when you pay more. You pay more for health care. You pay more than you initially intended to pay. I'll say it that way, right? So what could have started off as just being on 2 or 3 medications, now you're on 4, 5, and 6 because you weren't consistent in the beginning. And so they are telling you consistency is beneficial for both you and me, right? You as the client, you as the customer, and us as the billing company. And so I help patients with that. And I help them understand the beyond part. So that's where the scripts comes from. The scripts is the prescription, but the beyond part is the lifestyle changes and helping them understand what needs to be incorporated so that they can, again, achieve those outcomes. Because I really believe no one wakes up and says, I want to be on medication for the rest of my life. There are some conditions, there are some challenges that people face that when they get the education that they need, get the support that they need, and then are held accountable, those things can be reversed. I'm a firm believer of that, and I've seen it.
Yeah, yeah. Well, thank you so much. Thank you so much. We had some questions come. That was awesome. I'm telling you, I loved every bit of it. Yolanda had a question. So Yolanda, you asked about the vitamins. It's www.edlyn, EDLYN, essentials.com. I'll add it to the comments when we get off the line, but you can go to the website and order your vitamins for women over 40. Also have plant-based detoxes also, which everyone's loving right now because of the new year, new you.
That's right.
Off the line, but go to the website and order your vitamins for women.
I'm not sure what I just did. I'm sorry. Thank you. Sorry about that.
No worries. Okay, so being consistent and or pay for your mistakes. I know that's right.
Yes.
True. That was very, very true. LaDanya had another question about naturopathic medicine, and is this best practice alternative? Is this a best practice alternative? I'm all about the naturopathic. I think that, like you said, it's no one one stop for everything. You know, everything is not for everybody. Traditional medicine may not be the route. You know, we all should be trying to eat clean and you know, drink water and try to pour things healthy into our bodies. But you know, what's your take on naturopathic medicine?
I am an advocate for it. I am. I've seen people really reap the benefits of it, but I think it goes back to what we stated earlier. It depends on the person. You have to do the research, do the education, connect with knowledgeable, keyword knowledgeable, up to date professionals to make that best decision. But absolutely, and I think anything, whether you decide to go the natural route or not, consistency is going to be key. You have to do the work. You
Yeah.
have to do the work. It's not a magic pill. It's not a magic remedy. It's not a magic potion. You still have to do the work, and
Agree.
that's the bottom line.
Yeah. Well, thank you so much. So last point
Thank
is
you.
please tell us how we get in contact with you. How do they get in contact with you and how do they get more information about Scripts and Beyond?
Sure. The website is scriptsandbeyond.com. Or you can go to drlesliehodge.com. It will take you right to that site as well. So again, scriptsandbeyond.com
Is
or
it A&D or is it the sign?
no, it's AND. Yes. So SCRIPTS and AND beyond BEYOND.com.
Okay.
Yes.
Yeah.
And even on social media platforms, same as Scripts and Beyond. And the phone number is 888-415-0656. Even if you just want to ask some questions and just really learn how to have that conversation with your prescriber. Because again, as we talked about earlier tonight, that's very difficult for a lot of people. They're just not sure what to ask or the wording to use to ask to get the response that they need and want.
So give me the telephone number again. I'll put it on the screen.
Sure, it's 888
Mhm.
415 0656.
Okay. So it'll be in the notes, guys, and you can reach out to Leslie. She'll be in the comments, and you know, answering questions and giving her contact information. We'll have all of that up so you guys can reach out to Dr. Hodge. Thank you so much, Leslie.
No, thank you. Thank you. It's been a pleasure.
Right. This is not a play, you know, this is not anything for the faint at heart. If you are looking for something that is fleeting and here's something that is not going to ground you, this is not the place for you. But if you are ready to thrive, if you are ready to really just take your life to the next level, but take ownership of your life and where you want it to go, and not just flailing back and forth and allowing other people to suck it out of you. Right. Get the life back in you so that you can thrive. And this is what Thriving Thursdays is going to be all about. It's going to be here for you. As women, we serve so many people. But guess what? I and the women that are going to be on this show, we are here to serve you.
Absolutely.
Here to help you live truly a thriving life. And so thank you, Dr. Hodge. I cannot tell you. Thank you for being here. Thank you for pouring this good information on us. Yes. If you caught it late, make sure you share it, drop a comment, share, and just make sure we get this information out. Okay.
Absolutely.
Thank
Absolutely. Thank you.
you.
Happy New Year to you.
I see you guys next week.
Bye-bye.
Bye.